Hey guys, Tony Maritato here, physical therapist, and there was a great question that came up in the knee replacement support group. So Kathy was asking, looking for exercises for tight quadricep muscles, any suggestions? So ironically, we were literally just talking about this in the clinic yesterday. This is an interesting situation. So there's a huge difference between the sensation of a tight muscle versus a truly tight, shortened muscle. So I want to talk about these two things. Most of the time when a client tells me I have a tight muscle, it feels tight. The muscle itself is giving the brain information to say, hey, this sensation that I'm feeling is tightness. We need to stretch, but the reality is the muscle itself is not actually tight. It's not actually restricted. It just is telling the brain that it feels this way. A great comparison is if I bite into a jalapeno pepper, the pepper causes my lips to feel hot. The temperature of my lips feels like they're on fire. But the reality is if I took the temperature with the thermometer, my mouth would be a normal temperature. It's the sensation of heat. I'm guessing Kathy is feeling the sensation of tightness. So if we want to change that sensation of tightness, that's a very different approach than if she has actual restriction. Now, it's almost impossible to know if the quadricep is actually tight if the knee does not have full range of motion. I don't know if she has full range of motion or not, but I'm going to address this from the perception of tightness, not actual legitimate tightness. Because actual tightness could be caused by neurologic issues, and it could be caused by scar tissue or connective tissue restriction. So I'll save that for another video. But in this case, we're going to say, okay, the quad feels tight. And for those of you who don't know, the quad is the front of the thigh. It's made up of 4 muscles. It crosses the hip, it crosses deep into the body, attaches some into the spine, and comes down and crosses over the knee. The kneecap is sitting in the patellar tendon. But anyway, so the sensation of tightness in the quad. There's 2 ways that I like to approach this. One is with the rolling pin massage. Now I have a ton of videos on here showing you how to use the rolling pin to massage the thigh, the quadricep muscle. You can do it with the leg straight and the muscle relaxed. You could do it with the knee flexed and the muscle under a little bit of tension. Either way, a rolling pin massage is an amazing tool to help alleviate some of the sensation of tightness. You also can use a massage gun. Some of you have seen some of my videos using massage gun to give you that sensation that's different than the sensation of tightness. But truly, probably the best way to alleviate the sensation of tightness in the quadricep muscle is to exercise the hamstring muscle. So the muscle that's opposite where you feel the tightness. We call it the agonist, antagonist, but the whole idea is the way our brains work, the way our body works. If I tell my brain tells my bicep to tighten, reflexively my tricep has to relax. The opposite muscle has to relax. Conversely, if I tell my tricep to tighten, my bicep has to relax. So if you're feeling tightness in the quadricep muscle, the quadricep is responsible for extending the knee. Do exercises that work on flexing the knee. Activate the hamstring muscle. That will cause the quadricep to relax and typically will relieve some of that sensation of tightness. Now, if you try to work the hamstring and you're limited in knee flexion and you push it too far and you aggravate the knee itself, now we're dealing with a different situation. So some of my favorite knee flexion exercises, you can stand at the counter. I've got a couple of these on the YouTube channel. You can stand out at the counter and just flex your knee, pick up your heel toward your backside. You can lay on your back and do what we call hip bridges. If you're familiar with these, awesome. You can also lay your feet on top of a physio ball and you can do some of the physio ball rollouts. There are heel slides, classic heel slides, focusing on pulling the heel back toward your hip more than pushing the leg into extension. So those are my 2 main recommendations. Work the hamstring muscle and massage the quadricep that should alleviate much of the sensation of tightness, but it is something that has to be done repeatedly. It's not the kind of thing that you do twice a week for 20 minutes and you fix it. It's as you feel that quadricep wanting to tighten up a little bit, the sensation of tightness, you do a little massage, you do a couple activations of the hamstring, and then maybe an hour later, 2 hours later, you feel it starting to tighten up again, you do it again. You repeat this process multiple times throughout the day to condition the brain and the nervous system to say, hey, the quadricep is okay. I don't need the sensation of tightness anymore. It's not protecting the knee anymore, because that's typically what it is. It's a reflexive kind of guarding, we call it, tightness. You know, the way our bodies respond to pain is if I poke somebody, they tighten, they recoil. That tightness is a protective mechanism natural within the body. You're just trying to teach the nervous system to say, hey, we don't need to be so tight. We don't need to be guarded or protected. Everything is okay. Guys, if you have questions, as always, I'll do my best to get to them. Post them in Facebook in our group, post them on in the comments on YouTube. None of this can ever be taken as medical advice. I'm purely sharing ideas that I would share with physical therapy students and assistants in the clinic so that you can go take this information, talk to your therapist directly, and see if it's right for you. I'll catch you guys on the next video.